Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about hypercoagulation of the blood in conjunction with tick-borne illness. And also you do see it with mycotoxin illness as well. And this is when the coagulation pathway is activated due to the infection and inflammation from the tick-borne illnesses. There definitely is a genetic component to this, and there are genes such as Factor VIII Leiden and Factor V Leiden that can contribute to a hypercoagulable state. Hypercoagulable state means that your blood clots quickly and it's thick. And it's very common with tick-borne illness. That's why a lot of times when you go to get your blood drawn, the phlebotomist has a hard time drawing your blood. It comes out very slow. It's a very dark maroon color. It looks unhealthy. It doesn't look like a cherry red color that a healthy person's blood looks like. So some of the labs that are abnormal in hypercoagulation are D-dimer, that's an indication that there's a clot, fibrinogen activating, I think it's called, no, fibrin. Fibrin is a molecule that builds up in the vessels. It's like the equivalent of kind of a scab or the healing of a wound. And it's very, it makes the blood very, very thick. And tissue plasminogen activator, TPA, that's another one that can be elevated. So when you see, especially D-dimer, you need to use proteolytic enzymes, things like Boluoke, Natto, Serrapeptase, Bromelain, Wobenzym, things like that, because those enzymes will chop up the fibrin molecules, and by chopping them up, then your body will get rid of them through excretion or stool elimination, and then your vessels are much healthier when they don't have all of that fibrin and cholesterol clogging them. It's like debris on a highway. So hypercoagulable blood is very common in both tick-borne and in mycotoxin illness, and it's also very common in COVID. We see lots of microclots in patients with long COVID. Again, when it's really, really severe, you might want to try using heparin or Lovenox. Heparin you can do sublingually. I have patients do it sublingually, and it will dissolve the clots. Or you can do a sub-Q injection of Lovenox, and that will help dissolve it as well. It's definitely not something you want to just ignore, because those clots, they become bigger and bigger and bigger, and then they can get dislodged, and they can go to your lung and cause pulmonary embolism, or they can go to your brain and cause a stroke. So you really want to make sure that your hypercoagulable blood is dealt with either via heparin, Lovenox, or naturally with proteolytic enzymes. So I hope this information has helped you, and I hope you have a wonderful day. Take care.